Dr. Crayle, let's talk sleep apnea. Basically, people who are snoring and stop breathing throughout the night. Now, not everybody who is snoring stops breathing, but most people do. And lately, there's been tremendous amount of news out there. Apparently, there's more people currently they're having a car accident. They wrap a car around the ball, literally. In New Jersey, it was just a bus driver who wrapped a bus around the ball, and lots of people died, and he was falling asleep, and they suspect that he had sleep apnea because everything else is fine with him. And more people have car accidents falling asleep on the wheel than there is people driving drunk. And that's quite alarming. So, and dentists apparently can fix that rather easy. There are other ways also of fixing it, but a dentist apparently can do it good, easy, and frankly more comfortable than the other ways, which would be what's called a CPAP machine. Anyway, shed some light on sleep apnea, a little bit what the whole thing is about. How can you guys fix it? But definitely tell us about the implication not sleeping and not getting air throughout the night, even though the person doesn't know it, is having on him.
Well, there's different degrees of sleep apnea.
Sure. And
different solutions depending on the severity of the situation. I mean, you can go from just some snoring and maybe a very brief interruption in the breathing pattern. On the other hand, there can be situations where the throat actually gets blocked from the tongue or other structures in the throat to cause some serious blockage of the airway. And in that case, then the person would be awoken multiple times during the night as the body struggles to maintain the oxygen. And that can, if it's gone on chronically like that, of course it can lead to chronic fatigue, high blood pressure, and other problems. Obesity as well.
Wow. Well, because you don't sleep. Now, chronic fatigue, right. That's a big one because, again, I know many people, it looks like they wake up exhausted and fatigued and tired, yet they did sleep. And throughout the day, I remember my wife, about 24 years ago when we met, and then there was, sometimes she thought I'm upset with her. And we would have this little argument about me being upset, and she saying I'm upset, and me going, I'm not upset, but you're upsetting me talking about me being upset. And what happened is it took us half a year or so till she finally realized, she was the one who realized it. She says, whenever I think you're upset because you're not speaking to me, I sit on the kitchen table and just, sit there, drive in the car, and I'm like a, non-stop talking guy. But she goes, I noticed you are tired. So when people are tired, obviously they're lifeless, and then no wonder their life, their career, their love life, everything doesn't go so well. Never mind, as I said, they're having the accidents. Apparently the car accidents with sleepless people are worse than the drinking ones, because at least the drinking one, he tries to kind of like get it. The sleeping one, he just passes out and he goes straight over the cliff. So how... what is involved for a patient to get these appliances from a dentist? Is this very complicated?
Well, if we're talking about someone who is snoring, no. We can make an appliance to help with the snoring. It's just a matter of making some impression molds of the upper and lower teeth, and then come back 2 weeks later, and then we'll have the appliance ready, and we can put it in and fit it to their mouth so that they feel comfortable and they know how to use it. Then they take it home and they start using it. And then they should notice some improvement. They may need to come back for a little adjustment. That's fine. We can do that too.
Okay. Now, when you say snoring, but, snoring in most cases, are you applying, like here, snoring in most cases is related to waking up during the night, which means you don't get enough rest, and or even stop breathing for periods of times all the way up to whatever, a minute or so. And apparently that happens a lot to those people. Depends on mild or not so mild. 10 times an hour, 20 times an hour, and all kinds of things, and probably less. So would that appliance stop the sleep apnea?
Well, like I say, there's different degrees. If it's a matter of snoring, and it depends. If the breathing continues, then they wouldn't necessarily be awakened and tired, although if there's anybody else trying to sleep in the same room, they may be kept awake by the snoring.
Right.
But yeah, if there's really a problem, a significant problem with stopping the breathing, then the person may need to do what's called a sleep study, and they may need to have some other treatment, like you mentioned, maybe CPAP machine or some other treatment that could help them with the more severe form.
Right. So I've heard that there's, the really, really, really severe form, which is not that often happening. They might need a CPAP machine, but apparently people with a CPAP machine have a tremendous hard time of sleeping with it. It's just so uncomfortable that most of them don't do it, except the ones who they know if they don't wear it, they'll die. Super advanced sleep apnea. But most other people, even though maybe the snoring guard or whatever you call it, the sleep apnea guard from the dentist is maybe second good to the sleep apnea, because people are wearing it, however, because it's apparently not all that uncomfortable to wear it. Now, that device is a lot better than a CPAP, simply because the CPAP, 90% of the time, becomes unused after having spent a couple, $2-3 on it. And the sleep apnea appliance is obviously much cheaper, much more comfortable to wear, so people do wear it. So even if it is not quite as good as the CPAP machine, because people are doing it, it at least prevents tremendous amount of damage. Is there some, am I right there or what?
Right, the patient has to be able to be comfortable with it, to be able to use it regularly so that they can get the benefit from the treatment.
Right.
Yes.
Because with sleep apnea, if you wear the appliance, whether it's the CPAP machine or the mouth guard, the night you don't wear it is the night you stop breathing and it's back to normal. It's not, it's like with eyeglasses. If you don't see, you don't see. You put them on, you see. You take them off, you don't see. That's how it is, right?
To some extent, yes, that's true.
Yeah. All right. So good. Anything else people should know about it, rather than that if they're sleeping, if they snore, that's an indication. Maybe their spouse or whoever sleeps next to them might notice that they stop breathing. They might not, because they might sleep deep themselves. But if he snores, if a person is slightly exhausted, slightly tired, especially in the afternoon, because basically, I literally have heard that, how people drink an espresso or Coca-Cola or some other Red Bull drink in the afternoon to boost them up? Well, apparently one of those dental devices stopping the snoring, a good thing in itself for if somebody else is in a room, as you said, getting the person to breathe regularly by getting the most important thing, the oxygen, the person becomes more energetic, isn't tired, isn't exhausted, and for all purpose, that's the best pep drink you can get. The best afternoon booster you can possibly get is your dentist. Unbelievable. Yeah. So if a person has those things, again, would it be wise for him to go to a dentist and get checked, and or have then the dentist refer him to a sleep lab, or vice versa, sleep lab referring him to a dentist, coming to your dentist? Simply, yes, the sleep lab, most of the times they go a CPAP machine, and a person who can stand it, fine. Most people can't, and very difficult to travel with it. It's, after all, a big, clumsy 2, 3, 4 pound thing. It's much larger than a computer, much more clumsy to carry around. So obviously that appliance would then be should be one of the first choices, except if it's super severe. Am I right there?
Yes. Well, we have to assess the disease and see at what point the patient is at and what would be the best solution for their particular needs.
Good. And you know where to send a person for a sleep test if you think it's indicated?
Yes, we can refer them to a physician, yes.
Beautiful. Thank you very much, Dr. Crayle.